Please, immediately you join the class, kindly mute. It's very important so that you don't disturb the class. I hope your people, now all of you have the information that instead of 2, we are meeting 12. The number is down. And I wanted to know your total number. Up to now, I'm not sure. So I don't know the total number of students so that I can monitor.
We are more than 400.
We are more than 400.
We are about 400 plus. I think we are 500 and something.
500 and something, okay.
Yes.
Thank you.
Please welcome.
To the course reps, it seems now I have your contact. I would like to, after the session, at your own convenient time, kindly send me the total number of students at your center. Check on your page and give me feedback. Thank you. So if you are 500 plus, and we have, now let me check our number here, 278. Gifty Abna.
Come
Okay. Last week we met briefly and we made an introduction of the course Behavioral Science. We talked about the course outline. I'm very sorry I couldn't send you as I promised, but it wasn't my making. I have internet issue. How to get the documents on my phone to send was a problem. But after this lectures, now the internet is stable. I will upload it on my phone and send it to you. Both the course outline and the slides. Thank you for your patience. So last week we discussed about the course, the introduction of the course and the topics that will be treated. We shared ideas on when we say psychology, what does it mean? Now we want to look at what psychology is. What is psychology? We also want to talk about the misconceptions about psychology. Can you share your idea about misconceptions on psychology? what people think. Portia Ishan. Portia, your hand is up. Please unmute and talk.
Hello, sister. Please,
Yes.
some of the misconception I can talk about is when you come to our community and you talk about psychology, most people think we are talking about people who are crazy and walking on the streets naked and stuff like that. So some people, when the moment you mention psychology, that's what they think about. But
They
I
think
think
about, please come again. They think about,
they think about people who are crazy, like people who are naked, walking on the streets, stuff like that. That's what most people see when you mention psychology.
okay. All right, thank you. And so
Sister.
Portia, please lower your hand. And Asempa.
Yes, sister. What I know about psychology that goes around is people think you can use sex to make them tell you what they are not willing to say.
Okay, so something like magic.
And then yes,
Okay.
and then they think it's
Or reading your mind.
exactly. They think it's a mind game you play on them.
Okay, okay, thank you. Gertrude. No, sorry, a free or say a free.
About please.
Say a free, yeah. Gertrude is speaking, all right.
Please, sometimes they feel it's witchcraft because when you're able to study what they know and then they will give you a response to the same thing, they feel like you are doing some kind of witchcraft.
Please, can you come again? Gertrude, I didn't hear you clearly.
I said most people think psychology is about witchcraft because you know what
It's about
class, like you are doing some kind of juju.
juju. Okay. Something like superstition. Okay.
Thing at any point in time and you tell them about themselves, they feel like you are going beyond natural powers to read their mind.
Okay. All right. Thank you for your ideas. The last hand, Justina.
Yeah,
Justina.
so good morning.
Good afternoon, dear. I don't
Please,
know where you are.
good
Are you in the US?
No, I'm from Tamale.
Are you in Ghana?
Tamale.
Tamale, okay. Tamale is Ghana. All right. Justy, hand was up.
Yeah, psychology is the study of human behavior and other living organisms. Thank you.
Okay, thank you. So we talked about the psychology definition last week. We want to look at the misconceptions, and most of you have shared your ideas. Thank you very much. So let's go on. Please, the rest we'll call you later. So these are some of the misconceptions. People think psychology is mind reading. I remember one of you said that some think it's about magic or trick. We trick people to share their mind with us. Some also believe that it's what fortune telling.
But that's not no.
It's here.
Thomas.
Oh, please. Who is that? Okay. So as we were saying, in reality, the mind reading is the conception, but the reality is psychologists don't just read mind. They use observation. That is, as you have a client or you have a patient, we observe. We also use assessment tools through scientific methods to understand the behavior and the mental process of that individual. So it's not about supernatural abilities. as people think. Okay. So it's not magic, it's not traits. As people think that psychology is also not real science. But the reality is psychology is what? It's a scientific field that relies on research, statistics, experiments, and evidence-based practices. And it follows what? Systematic method, similar to what? Other sciences. So these are the misconceptions that people have. But the reality is we go through the what? The scientific method. We use observation, we use assessment tools to come out with the results. So when we say that psychology is reading somebody's mind, that is not true. So these are some of the misconceptions. But we can say that psychology is rather about the what, how, and why of what? Human behavior. So when we say how, we mean how people behave. The why means why are they behaving that way? And what is really influencing that behavior being exhibited? So you see the red note here, note or NB. The NB means psychology is rather, so what people, the misconceptions that people are talking about, mind reading is a trace, is also what's a fortune telling. We all have what's a reality behind this misconception. And the main is based that psychology is about what, how, and why. And I'm saying again that when we say the how proves people's what behavior, the how proves people's what behavior. The why is how are they behaving that way? Why are they behaving that way? Then the what is means something is influencing that behavior. So I hope we get it. Mary, so what means we want to find out what is influencing the person's behavior. Why? The why is the person behaving this way? Then the how is the behavior the person is putting up. How? How do the people behave, or how do the individual behave? Why? Why are they behaving that way? What is influencing the put up behavior? I hope we understand. So we want to look at psychology, as we have said earlier, that is what is a scientific study of human behavior and other organisms. 2004. And psychology comes from two Greek words, the psyche and logos. So psyche means what? The mind. When we talk about the psyche, is the mind. And logos means knowledge or study. So these two words come together to form psychology. And it is about what? The understanding people and the mind. So understanding people is through their behavior, their reaction towards situations, how the mind would work, how the mind is being processed. So we want to find out, is psychology a science? Psychology, is it a science? Already the definition proves that it's a science. We say it's a what? It's a scientific study of human behavior and other organisms. So if it is a scientific study, then yes, psychology is a science. So psychology is what is a science because it accepts the scientific assumptions. It adheres to the characteristics, and it also follows the scientific steps in studying human behavior. Psychology is studying human behavior and the mind. And it is through what? It is done through the scientific way. It is a science because it has set the scientific assumptions. It adheres to the characteristics, and it also follows the scientific procedure in studying human behavior. So it is not what people think that psychology is supernatural or is superstition, something like magic. No, it passed through the scientific procedures. So why do we say psychology is a science? And we have already explained that it follows what? The scientific procedures. It accepts the scientific assumptions. And one is the empirical evidence. What makes psychology a science? So psychology uses what? Scientific method. And it has what? Empirical evidence. They are variable by means of what? Scientific experimentation. Anytime there is a work concerning research under psychology, it passes through what? The empirical evidence. It is testable through the use of observations. So when a clinical psychologist taking care of a client or a patient, they go through what? These steps to make it reliable or to make it proof. They don't just do it anyhow. So they use what? Observation. They use interviews. They also use psychological testing to have what? A proof, or to base on that resource, taking care of their clients or their patients. So observation, that is identifying a behavior or a phenomenon. That is why the misconception, some say that we read people's mind. No, we don't just read, but we observe. At times you observe critically. When you observe the person, you identify the behavior the person is putting on. And based on that, you move or you step looking for maybe interview or other assessment tools to prove that what you observe is clear. So we can talk of the scientific methods, we can talk of the observation, formulating hypothesis. That is, you make what? A testable prediction. Experimentation. Testing the hypothesis under controlled what conditions. Then we have data collection. That is using statistics to interpret the results. Then we conclude by accepting or rejecting or modifying the hypothesis. Then we call something the replication. Repeating the study to confirm whether the findings were true. Yeah. So replication, all the procedures of the study must be described so that anyone
Dela, I'm not lazy anyway. That's lazy anyway. What do you matter? I'm not lazy anymore.
Please mute yourself. We are begging. Skydiving.
I went off. Okay. So let's continue. So we have the quantifiability. It's about measurement. And as part of the scientific method or the procedure. So variables to be studied must be in what? Quantifiable units. Quantifiable must be transformed into what? A numerical form. So as the study is being in progress, it goes through these scientific methods. Generalizability. So this is what finding gained from the study, and it must be extended towards a larger population. When a survey is done, or when you conduct a study, it should be what? Extend to the larger populations. It should be what? Benefited to everyone, not only where the study was conducted. So we want to look at what behavior is. As we are talking about, the psychology is the scientific study of human behavior. So what is behavior? behavior refers to an individual response to a stimuli. The behavior, or what a behavior is, we say it refers to an individual response to a stimulus or a stimuli. When we talk of stimulus, meaning is what? Singular. The plural is what? Stimuli. So the way an individual responds can be perceived by one's senses. It can be inferred by using instruments. So here, if you really want to find out why an individual is behaving this way, we use instruments. Or you can also use the senses, that is observation. So you observe by using your eyes to see, or you listen to what the individual would say. Instruments can be used. Oh, those making noise, please, you are not helping us. So instruments can also be used to find out the behavior of the individual. We want to look at the two types of behaviors. We said we have the covert behavior and we have the overt behavior. Can somebody mute
Rosina Mafo, mute your mic. Rosina Mafo, mute your mic. Abba.
So we are talking about the overt behavior. Overt behavior, this can be observed easily by what? The senses. An example are talking, dancing, clapping, etc. So these are the overt behavior. The overt means they are exposed or they are open. It can be seen by the senses. You can see you can see by your sight or your eyes. You use your eyes to see, and that is the observation. If somebody is talking, you can hear, using the ear to listen. If somebody is dancing, you can see the person dancing, clapping. So all these, can we mention some of the overt behavior? Overt behavior.
Talking.
The talking is there already. Mention
Sister,
what?
singing.
Singing, good.
Crying.
Please, sweeping.
Please raise up your hand. I call you.
Eating.
Eating. Thank you. So let's go on. Then we have the covert behavior. The covert is hidden. We don't see. And it can be what? Easily observed. It cannot be easily observed as we can see the overt. So the covert is hidden. And how do we get to know of the covert behavior? You have to use what? Instrument to observe, because it is hidden. An example of them is thinking. So if somebody is thinking, you wouldn't know unless maybe you have a conversation with a person and for him telling you or her telling you, you wouldn't know. Intelligence, they are all what? They can be measured. Meaning we can use instruments to measure this covert behavior. To make it what? Seen. Love is also what? A covert behavior. They are hidden. So as we mentioned, covert and overt behavior. They are characterized into reflex behavior. This occurs automatically in what? Response to a stimulus. For example, for the reflex behavior, you just produce saliva when you have what's the aroma of food. When you smell the scent of a food, automatically you salivate. Jumping when what? When one gets what? A pin pricked. Not even a pin. When you are just there and you don't know that somebody is approaching, if the person just tickle you, you jump. Those behaviors are what? Reflex behavior. They occur what? Automatically to a response of a stimulus. We have goal-directed behavior. Goal-directed behavior is when there is a need of an individual and the person strives towards satisfy it with what? Certain behavioral pattern. The goal-directed, the example can be a child who cries. When the child needs attention, he or she cries. When the child needs food or the child wants you to breastfeed him or her, she cries or he cries. And that behavior is called the goal-directed behavior. That behavior is for a purpose. Then we have frustration behavior. This was said by Mayer, 1949, when he said the goal of the behavior is specific. The person tries several times, but the need is not met. Finally, when the need is met, the person does not appreciate it again. That is frustration behavior. As in you are thirsty or you are eager for something. You try several times, you don't get it. Finally, when you get that, maybe that attention or that thing that you were crying for, or you feel you need it, when you get it, you don't appreciate it anymore. Can somebody make an example? Please, if you want to talk, raise up your hand. Bema,
Sister, please, good afternoon.
say, yeah, Bema will say, yeah, afternoon.
Please, frustration behavior can be like if a woman or a lady wants to is in love with a man. Let me put it that way. It's in love with the man, whereby the man is not even aware that the lady
It's in love.
secretly is in love with her. Is in love with him. Thereby, the lady can do all her possible best to like attract the man, but because the man doesn't have any feelings, nothing for the lady, there is no way that the man can forcefully get into that lady. So it will never work. Thank you.
So if it never works, but we are saying that, yes, the lady have tried severally, maybe because the lady cannot tell the guy that I love you.
Maybe the guys who her taste or like the lady doesn't meet her type of woman. So there's no way that
Okay. Okay. All right. Who again?
Hello,
Imam
sister.
Asempa. Yes.
sister. Please, I'll use getting a degree as an example. You've applied to a lot of schools and you are not being picked. You are very frustrated, and then finally, once school picks you, and then when you are learning it, you feel like, it's a new learning.
So it seems you don't even appreciate it. Another example.
Oh, no.
Hello, sister.
Yes.
Sister, this is Francisca.
Okay. So Anna, please lower your hand.
With the first example, the sister said that the guy will be struggling to get a lady. He will do everything to get that lady, but after getting the lady, he will no more pay attention to the lady as he used to do.
Exactly.
Can we say there's the frustration?
So you are saying that when you stretch, you have stretched the person.
Okay.
Now the person, after getting you, even sleeping with you, that is the issue. When they go to bed with you and they see what is there, the appreciation is being reduced. And if they are not really satisfied, then they will come not to say, so that is the frustration behavior. Finally, when the need is met, the person does not appreciate it again. And this happens in our lives. At times you strive for something, you try. And finally, when you get it, you don't need it anymore. So we don't really appreciate what we have. But when you lose it, you realize how important that thing is. That is the frustration behavior, the example that I can make. All what we have, we don't appreciate it. Especially, there are some people, they have their peace, they don't know or they don't value it until that thing leave them. So when you strive to get something, immediately when you get it, as somebody said, you after senior high school, you wanted to do what? Your diploma. You went to midwifery school. You went to college. After college, you are working, but you feel that diploma certificate you were striving for, now you feel it's nothing. You don't appreciate it. Now you want to what? Get a degree. So when you strive to get something, you do not appreciate it again. That is the frustration behavior. Edu Olivia, your hand is up. Edu. Okay, Dorothy.
Hello, sister, please. I wanted to give an example, but it's like you've said most of it. I wanted to talk about a woman who is looking for fruit of the womb. Like you do a whole lot of things and then you get it at age 50.
Exactly.
You will not need it anymore.
Exactly. At times when the child comes and they disturb you, then you feel that why did I even go in for this? When there is no people supporting you financially or even somebody to hold your baby for you to take your bath. And when you get a troublesome child, you feel that you are frustrated. Thank you. Dorothy. Edu Olivia.
Good afternoon.
Good afternoon.
Sister, please, an example is when you are stuck in traffic and you are late for an important meeting. You keep checking your watch. Meanwhile, maybe you need to get to the place and have the meeting, and then because of the traffic, you were not able to get to the place well. But then you yourself, you didn't meet the meeting, and then the traffic too also didn't make you get what you wanted rightly. So it makes you frustrated.
Okay.
Yes, please.
What about getting there and they said, oh, the meeting was cancelled?
It makes you more frustrated.
The time that the meeting is being held has been postponed.
has been postponed. Yes, makes you more frustrated.
Okay. All right. Auntie Jennifer. Auntie Jennifer will be the last person to talk. Then the rest you hold on for another. Auntie Jennifer.
Good afternoon.
Yeah, afternoon.
Please, I would like to talk about what the other sister said about a woman getting pregnant. Let's take, for instance, there's someone who needs a male child, and then she has gotten pregnant and given birth to 4 girls. She doesn't want to check the gender of the child because she feels that to give her that scare. So once she comes to the labor ward and then she delivers and she gets a girl, she ends up being frustrated. She doesn't want to even see the child and all.
Okay. Thank you. So the last one is the conditioned behavior. The conditioned behavior consists of behavior patterns exhibited by the individual due to long-standing habitual practices adopted by the individual. A behavior is being conditioned. The person is showing that behavior because of what? The habitual practices. For example, a person in a community that we are used to lateness. If we are supposed to meet at 7 a.m., that is the time. In Ghana here, we call something African time. It's a conditioned behavior. We have come to accept that, oh, if the time is 9 a.m., they will start at 10 or 11. People don't even give you specific time. Oh, around 10, 11. Oh, 10, the program will go on 10, 11. What is 10, 11? It is 10 o'clock. So at times, because of our long-standing habitual practices, we adopt such behavior and it becomes part of us. And when it becomes part of us, we don't even see it's what? We don't see it to be, how do I say it? We see it to be normal. We don't see it to be abnormal, but we see it to be normal. So if the time is 10 a.m. and I got there 11:30, it is normal. That is a conditioned behavior. Now we want to look at, okay, please let me pause here. From what we have talked about, from the misconception, what psychology is, the psychology as a science to behavior. If you have any question or if you don't understand anything, please, let's talk about it. Bring it out.
Hello, sister.
Yes,
This is Bema.
Mary.
Please, Bema. Bema.
Mary.
Florence.
Is it not
Please,
Mary?
it's Florence. Bema.
Sister.
Bema.
Bema?
Okay.
Okay.
Sister, about the categorization of behavior. I saw on the slide that you said there are 2 types, but I got the reflex. I had a reflex behavior, and I don't know whether the goal.
Okay, please listen. We said we have 2 types. The 2 types, we say we have the overt and covert, right? Then we
Okay.
came and said that the covert and overt that we said that they are the 2 types of behavior.
Okay.
That same behavior can be categorized. Those 2 types, the covert and the overt, it can be categorized into the reflex, the condition, the frustration, and goal directed.
Oh, okay.
I hope you get it.
Yes, but I saw it can be categorized into two. So I was confused. That we discussed more than two, so I got confused.
The two main. Listen,
Uh,
look at the slides. Two main types: covert behavior, overt behavior, right?
Okay.
Then, yes. Oh, obetumi afa bi. Oh, egum bebree fa bi why? Sorry.
Okay.
So we came again and said the two main types we talked about can be categorized into.
Oh, okay.
Please, have you seen it?
Okay. Yes, please.
So the two main types
Categorized.
be categorized into reflex, goal directed, condition, frustration.
Okay.
Yeah.
Condition. Okay.
So
Okay, I got it. At first I thought you said that one too has been categorized into two.
the
Thank
two
you.
main,
Okay.
that is the covert and the overt,
Okay.
can be categorized into the one that we talked about.
Okay. Okay.
All
Thank
right.
you.
May I know, Elizabeth?
Sister Prince, there are some behavior at the world, especially those people who will be coming for the night shift. There are some people they want to come late to come and change, and these same people want you
Want to
that
close
wait
early?
late. They want you to come early. Well, how are you going to how are you going to categorize
Understand. They
this
came to pick
behavior?
you
Sorry.
late. They came to remove you late, right?
Yes.
And
Yes.
you will come in the morning.
They want you to come
They
early.
want you to come
Yes.
early in the morning. They have forgotten that they delayed you. So even going home
How?
will delay you. Going to bed will delay you. So you cannot wake up early in the morning. That's it.
They want you to come
So
wake
that's
up early morning to come and
behavior. Let's work on that. Let's work on that
conditional.
condition. Please lower your hand, Elizabeth. So you don't have any question concerning all what we have discussed. All right, then let's go on. So we want to look at goals of psychology. Sorry, I'm talking and it seems I muted myself. And I'm talking plenty and it's not coming. Okay, please, when we talk about goals of psychology, the first thing we can talk about is the description. The first task of a psychology is to gather what information about the behavior being studied into present, what is known. So if somebody is putting up a behavior, and as a psychologist, you want to study that person. Why is the person putting up this behavior? You have to gather information. So how do you do it? A patient or a client is you are taking care of a patient or a client. and you want to gather information about the client's behavior. So you have to start from somewhere, the behavior the person is putting up. We said earlier that a behavior of someone is what? A response of what? A stimulus. Okay? So if the person is putting up a behavior that you want to study, we should start from somewhere. That is the root of the behavior to present. The root to present should be known. So we are making an example here that symptoms of depression, if you have a patient or a client that's maybe studying the client, I know some observations will come in, or you will use assessment tools. The assessment tools, depression tool is one of them. It's something like a questionnaire. It's given to the client to go through it. Some questions that you want the client to answer. So after answering those questions, we score and we get the results to testify that this patient or this client has depression. So going through this, using this instrument to administer on the patient or the client, you can also use what? Observation. Inclusive. You can also add observation. So, for example, that individual's behavior, you come to realize that depression, the symptoms of depression are what? Weight loss, problems with what? Sleep pattern, difficulty in what? Concentration. So through the questionnaire, all this will come up. And it will be what? A factor to prove that yes, this patient or this client is being depressed. So description is one of the goals in psychology. And it is the first task of the psychology, to gather information. Then we call something explanation. This requires knowledge. You have to explain why behavior is being okay. Is it shine? Shine Kekeli?
Yes, sister. Yeah, sister, please, I didn't understand the description aspects with the example you give.
Kekeli, yeah.
Yes, yeah, sister.
Your hand is up.
Yes, please. Please, I didn't understand the description aspect with the example you gave.
Please, did you say you didn't understand?
Yes, please, the description that you gave.
Description. You have to describe the behavior of the individual. And describing the behavior of the individual, you need to gather information. How do you describe? You gather information of the behavior being studied. So the patients that you are taking care of, you need to gather information about the of that client, the behavior of that client. And the example that I gave here is that maybe as a clinical psychologist or as a counseling psychologist, your client, you are studying your client to gather information, able to treat her or put her on treatment. So the example that we gave here is maybe client that came around and tools on the client. You came to realize that the client is showing symptoms of depression. And if a client has lost weight, the clients have problem with what? Sleeping. The clients cannot concentrate. This sense that was shown on your client. So when we talk about the description, you
Madam, please, your line is breaking. We can't hear what you are saying. Thank you.
Oh. Hello, can you hear me?
Yes, sister.
Yes, sister.
The internet is fucking up.
Yeah, because it's afternoon.
Okay, let me share the slide. Please, the one who asked about the description, I explained it again. But it seems the network, you couldn't get me. I'm saying that psychology or goals of scientific psychology, we have 4 major goals. Our first goal is what? Description. You have to describe the behavior accurately. And we are saying that example is what? Identifying or describing the symptoms of someone or a patient with what? Depression. Description is when you gather information about the behavior being studied. So for example, as a clinical psychologist or as a midwife, let's use your field. Maybe you understand. Yes, you have a patient, maybe she came with vomiting, weight loss, feels tired, spitting, and you sat her down. When she comes, there will be what? Communication. You want to find out what is disturbing this patient. So the patient will say, I can't eat well, I eat, I vomit, I spit frequently, I feel weak, I feel fainted, all those things. The patient will give it to you, like what he or she is feeling. But you as a midwife, you cannot just draw conclusion. You gather the information that the patient has given to you. And what do you have to do? Maybe you have to assess. There will be an assessment. My side, I will go in with maybe I will observation. You look at the client. But your side, maybe you suggest that the client should go for what? Lab test. And why lab test? Because you are basing on the information gathered. You looked into the patient's eyes, and you look like you have what? Studied the patient, and you feel that it's pregnancy, so you will suggest for PT. So why are you suggesting PT? Because you have gathered information of the behavior of the patient, and you feel that there is pregnancy. So first thing that will come into your mind is for him or it's for her or bemanyem or bananyem. So for her to what? Go in for PT. Please, I hope we understand. My people, are you there?
Yes, sister.
Yes, ma. Yes, please.
So now I'm using your field. We are using your field for the example. I'm saying that the goals of psychology, scientifically, we use 4 goals. We use description, we use explanation, we use prediction, and we use control or influence. These are the 4 goals of psychology. And the description that we are talking about is what? You describe the behavior of the individual. You have to describe accurately. And how do we describe? You have to observe the person, or you have to examine the person. So, for example, looking at the client, I said, let us use your field as a midwife. I know midwives, you also use description. I know. So, using description, you get a client or a patient that comes in and said, Madam, I feel weak. Anything I eat, I vomit. I spit frequently. At times, I faint. I have not seen my period for a month. This month, I have not. At times, you even come in with what? Questions. You probe to gather information. Because when the person say, I vomit, it is not only, you cannot base on the vomit to make a conclusion that the person is pregnant or the lady is pregnant. So you come in with more questions, you probe further, you explore to gather what? Information for you to be able to describe the behavior of the your patients, the behavior of your patients. So making the description, there are symptoms that will come out. And the symptoms is what? The weight loss. We are talking about a pregnant woman, a pregnant lady, maybe 0 to 3 months. The person spits frequently. The person eats and vomits frequently. So you gathering all this information, you predict. You have a prediction that, this one, it might be what? Pregnancy. But you wouldn't base on the prediction alone. So you say that, please go and do this test. And the test is the final what? Say, to prove that the lady is pregnant because of the symptoms the patient is showing. Comprehend?
Oui, madame.
Oui, madam.
All right. So after, for example, your side as a midwife, when the person brings the results and it is positive, then it will based on the symptoms that's made you think that the lady is pregnant. Now there is what? Empirical evidence. The test has proved that the lady is pregnant. You describe some symptoms before you allow the lady to go for the test. And that is description. Description of behavior. You gather information to describe the symptoms of the pregnant girl. I hope you understand.
Yes, sister.
Okay,
Yes,
now
sister.
we want to go to explanation. That is one of our goals. The explanation is explain. Hey. The explanation means you have to explain why this behavior occurs. So you see that from description, you come to what? Explanation. So the explanation, you explain how poor time management, there's an example, how poor time management leads to what? Academic stress. So here the explanation requires what? Knowledge of why the phenomenon exists or what causes it. So we come to the example that I was giving. A client came and taking him through the assessment tools, we came to find out that he has what? Symptoms of depression. Okay, so what really caused the depression? That is the explanation. So finding explanation is important.
You know what?
Into the process of what? Forming theories. A theory is what? A general explanation of a set of what? Observations or facts. From the description, you come to explain. You explain why those phenomena exist. So I'm giving an example here. For example, under the explanation, you can explain how poor time management leads to academic stress. When you're not able to manage your time, you are being what? Loaded with things that you have to take care of. And it's end up what? Stressing you. So that is the explanation. The next one is prediction. Prediction is the ability to anticipate an event prior to its what? Actual performance based on knowledge of what? Underlying causes. So being able to predict what? Future behavior based on what? Research findings. That is an example that I can give. That's predicting that a student who sleeps less may perform what? Poorly academically. Prediction is anticipation. You anticipate based on findings. Maybe what your client has said, you predict that this is the cause of his depression. So let's look at this. The knowledge of what causes depression, for instance, helps anticipate what? future occurrences of a behavior or not. And prediction helps to control or modify behavior to make it what? Much more adaptive. As a clinical psychologist or as a counseling psychologist, when you are able to explain to your client that this caused your depression. And why are people depressed? At times people overthink. Maybe there are some things that they feel they should have gotten, but it's not working this way. Some are being depressed because they don't have job or financial issues and other things. When you overthink or when you are not able to be positive or you don't stay positive of the situation, it can depress you. And when you are depressed, you cannot concentrate, you cannot sleep, you cannot even eat well. So we are saying that the causes of the depression, we anticipate or we predict that somebody with depression, it might be that there can be future occurrence. Normally, when we are taking care of a patient, we normally look at their history. We look at their history and you realize that this sickness has reoccurred. The person has what? The person has already been healed of this disease before. And if the person do not take care of, let's talk about those with sugar. If you have sugar, you are being treated and you feel that is gone. If you don't check your diet, you will see that the sugar will come again. You'll be diagnosed again. So it's a prediction that we make, that we anticipate of prior performance based on our knowledge. We think that this thing can be can occur again. And that is the prediction. That's the meaning of prediction. So we have the last one, which is the control or influence. And it is also called creating changes. We influence or control behavior in helpful way. One of our goals is to help patients or clients to control their behavior in a helpful way. That is one goal of the psychologist. They are interested in discovering ways to use what is already known about people to benefit others. So this is an example that I can give. Control or influence. Simple means you modify or you improve behavior when necessary. That is a simple way to understand it. Modify or improve behavior when necessary. So example is teaching study skills to improve academic performance. At times you want to help your students to improve their academic performance. You give them learning skills, or you help them or you modify your teaching for them to understand you as a lecturer. Then you guide them to go through with learning skills to improve their academic performance. So the fourth goal of psychologists is creating changes. Either it's creating changes or influence or control. So understand, when you hear creating changes, It can also be influence, or it can also be what? Control. And we are saying that creating changes means we create changes in a positive way. You create changes in a positive way. We influence behavior in a helpful ways. Now we want to look at parapsychology or pseudopsychology. Because please, any questions so far? Okay, so let's continue. When we talk about parapsychology and pseudopsychology, what comes into your mind? What have you heard about parapsychology and pseudopsychology? Okay, there are two hands up. I can't see. Mabel.
Yes, ma'am.
Yeah.
Ma, good afternoon.
So
Please,
one at a time.
If the studio psychology, what I understand is a force psychology in which the person may not, well, maybe what the person is thinking is not the right thing, but to him or her, she thinks is the best thing. That's what I can say about it.
Which one? Is it the parapsychology or the pseudopsychology? All of them.
The studio psychologist.
You say pseudopsychology is what? Please come again.
I said the studio psychology. My understanding is it's something maybe you may be imagining that, oh, this is the right thing, but it's not. It's a false something that you are just imagining something.
Okay, it's a false. I didn't hear the false. That's why I told you to come again. Okay, thank you. Who else? I saw about 3 hands.
Good afternoon, madam.
Yeah, afternoon, dear.
And please, I know that pseudo means false or something which is not there. So right now, psychology is the scientific study of human behavior. That means that the pseudo psychology will be false study of human behavior.
Okay. It's a false study of human behavior.
Yes, ma'am.
Please, the next person should talk.
Madam,
The
good
hands are many.
afternoon.
How about 6?
Good afternoon.
Good afternoon.
Please, this is Mary.
Auntie Mary.
Please, the parapsychology is a type of psychology which is beyond psychology, which is beyond
It's
it.
beyond psychology. Okay.
And the pseudopsychology is a type of psychology which is false and cannot be scientifically proven, although they say it, but they don't have any scientific means of backing it up.
Okay. Thank you very
It is
much.
false.
Hello, sister.
Yeah.
Please, I want to talk about the para one, the parapsychology.
Okay.
Sister, please, what I can say about it is that one is either scientific or academically alleged.
Academically alleged.
Yes, please. That is how I understand the parapsychology.
Okay.
Yes, please.
All right. The other hands.
Okay, sister, I would like to talk about the parapsychology. to my understanding, it is the scientific study of behaviors that seems to bypass, let's say, the laws that have been stimulated. Like it seems to bypass one's imagination, set laws.
It's past what?
Like that one is a type of scientific study of behavior that appear to bypass known laws.
Okay.
Mr.
All right.
With the parapsychology
Please,
thinking,
who is talking? Your voice is very down.
Abigail Dairy.
Okay, Abby.
Yeah. With the parapsychology, it simply means beyond psychology, and then the pseudo psychology, false psychology. And then with these two psychologies, they cannot be verified by others.
Okay. Okay, so thank you very much. The rest, you talk later. Thank you. Let's go on. So from what you have said, you have done well. So when we talk about the para and the pseudo, I said there are two broad areas which fall outside the scope of psychology. Pseudo and para, they fall what? Outside psychology, the scope of psychology. They are not even parts. They are on their own. So, para psychology literally means what? Beyond psychology. This is beyond psychology. Then the pseudo term as what? The false psychology, because the methods employed by practitioners are not scientific. Those using what? False psychology or the pseudo psychology cannot what? Explain. They cannot explain with what? Scientific method. So we say scientific methods are what? Currently the only method endorsed and used by credible what? Psychologists. Para and pseudo deal with what? Behaviors and phenomena which cannot be verified by others. And I hope we understand this. If you don't understand, please, let's explain further for you to get the meaning or the understanding so that we go on. If you get the understanding, then let's go on. So as I'm repeating again for you to get the better understanding, we said that para and pseudo, they don't fall in the scope of psychology. They don't, or they fall outside the scope of psychology. Parapsychology, it means what? Beyond psychology. And the pseudo is what? The false psychology. And why are they saying it's false? The pseudo. They are saying it's false because it does not what? Used scientific method. It does not use scientific. Those who practice pseudo-psychology do not use what? Scientific method for evidence. They cannot prove their results scientifically. So we are saying that scientific methods are currently the only method endorsed and used by credible scientific method for their work. Please, can you hear me? It seems my network.
Yes, sister.
Okay.
No,
All right.
sister, please, we didn't hear what you said.
Please, can you hear me now?
Yes, sister.
Yes, sister.
All right.
Yes, sister.
So I said that para and pseudo, they fall outside the scope of psychology. And para means beyond psychology. They are beyond psychology. The pseudo means what? False psychology. And why are they saying it's false? Because it cannot be proven by scientific method. And as we are saying, credible psychologists, they are endorsed with scientific methods. So para and pseudo deal with behaviors and phenomena which cannot be verified by others. For example, when psychologists conduct studies and bring results, they pass through the scientific procedures. Anyone who wants to conduct that same study can and also bring out the results which are what? Similar to the previous studies conducted. But when you come to pseudo, what they are doing, they cannot what? Prove it through scientific base. And somebody cannot conduct study because it is not scientific proven. I hope you understand and I hope you get me. So let's go on. When we talk about the parapsychology, the parapsychology goes beyond the five senses. And we call such processes what? Extrasensory perception, ESP. So ESP is unproven. The ESP is the unproven ability to communicate, gain knowledge and information outside the use of the five senses. So when we talk about the para, they claim to go beyond what? Normal scientific explanation. They go beyond that. They go beyond that. They go beyond the five senses. And as we are saying, is the extra senses what? Perception. So reported ESP, that is the extra senses perception experiences, involves what? Telepathy, clairvoyance, precognition, the psychokinesis. So we will look at them one by one and what they mean. And as we all know, the five senses is accepted, but this one, they say they go beyond the five senses. Can we mention the five senses?
Sister, the eye, the nose, the ear.
Yes.
So when you mention the eye is used to see of sight. Yes, you have to
Yes, please.
you know the sense.
Then the nose for smell.
Please, one at a time, one at a time. You are not at Makaranta. I'm sorry to say that, but I'm sorry.
So the eye for sight, the nose for smell, the ear for hearing.
Good.
The tongue for taste.
The tongue for taste.
The tongue. Yes, please.
And what again?
The tongue. Yes.
You have left one. No.
Same for touch.
For touch.
And the same for touch. Yes.
Yes. All right. Thank you very much. So as we are saying, when you come to parapsychology, they go beyond this. And they have mentioned some of the experiences involved in telepathy, clairvoyance, precognition, psychokinesis. You look at them one by one and know what they are meant for. So we have telepathy, and this is known as what? Thought transfer from one person to another without the mediation of any known channel of communication. You are communicating with someone, but it has no medium of communication. One is said to experience this when a thought you have or something you are thinking also occurs to another at the same period. Hey, those making noise. Okay.
If you are blind, Olivia, please mute yourself. You are disturbing us.
Okay. So let's go on. I hope we understand telepathy. We are saying that it's a way of what? Communication without any medium of, it's a way of transfer of thoughts. Yeah, it's a communication, but it has no medium or a channel. And we are saying that one is said to experience this when the thoughts you have or something you are thinking also occurs to another person at the same period. Can we share experience of this, or we don't? If you don't understand it, please, you can say so that we explain further we explain further for you to get the understanding. Then we can also share examples to
Madam,
get the
please.
understanding better.
Hello, madam.
Yeah. Yes. Yes.
Madam, please, good afternoon.
Good afternoon.
Please, this is Helen.
Oh, okay. But I saw Fauza two hands, so I thought the one. Ellen.
Okay, sorry. So please, sis, please, I can't really get. Yes, so yes, sister. Please, I don't understand this part, telepathy. I don't really get it. Can you please go
You
further?
don't get it. All right.
Yes, please. Yes,
So
please.
we are saying that.
Please, I wanted to give an example of the telepathy.
Okay, so please hold on with your example. Okay, give me the example. Give the example. If you give, it might give a clearer understanding. If it does not, then I will explain further. So give your example. Yes, I'm listening. The one who said he's giving example, she's gone.
Okay, sister, please, can I also give my example and see if it's the same thing we're talking about? Let's say something happens and then we are through there and then both of us say A at the same time. Is it what you are talking about?
When all of you say, maybe there was a communication going on.
Yes, and then both of us said says A at the same time. Is it telepathy?
As I'm saying, if there is a communication going on and you are saying A, it is normal. It is based on what you are talking about. Please, do you get me?
Yes,
Sister, please. Please, can you explain the telepathy again for me? I didn't
So
get it
let
clear,
me
please.
explain the telepathy.
Please, can I
The
give my
telepathy, we are saying that it is known as thought transfer.
Okay.
I'm thinking about something, and what I'm thinking about is transferred to another person without the mediation of any channel of communication. This that I'm talking about, the transfer, as I'm thinking about, I want to eat banku and pepper, right? That is the thought I have. Then right away, my mom calls me. I'm preparing banku and tilapia. So don't eat. When you come home, you eat. So how did my mom knows that I have to take evening supper, banku and pepper and fish? Please, I hope you understand. There is what? A transfer of thought. There is a transfer of thought from what I was thinking about. When I go home, I will eat banku and fish. After few minutes, then I receive a call. I'm preparing banku and fish too. So when you come home, you come and eat. I hope you understand the example that I'm making. I didn't call my mom to tell her that I want to eat banku and fish. So how I can explain it for you to understand is something in English we call coincidentally. Coincidence. Telepathy can be coincidence. That is what we will say that is a coincidence. But when you go to parapsychology, they say it's what? Telepathy. And it happens. It happens. Let me share my experience with you. Just last week, I sent some pictures. Oh, the background is noisy. The background is noisy.
Mute yourself. Why are you disturbing the class?
Mute yourself. Gifty, mute yourself.
Please mute yourself. I'm trying to mute her, but it's not working. So there are 2 o'clock or not in a baby, no, it seems she's not even here. Okay, let's go on. So as I was saying, I said I wanted to share my experience. Was it last? It could be last 2 weeks. I sent a picture to colleague. Oh, excuse me. Let me call the IT guys and see if they can help. Open our machine. Lady back, or ye did it, pa, mean, the same muting as mean to me. 50 abena, what's it? Come on, say. Oh, ye did it. Oh, ye did it.
Into waiting room. Why say muting?
Yeah. Okay. So let's go on. Finally. So as I was saying, I wanted to share my experience with you. We are saying that the telepathy is thought transfer. As you are thinking about something, it's transferred to the person, and the person also have that same thoughts without any medium of what communication. So as I said, I wanted to share. It happens to me a lot. I said I want to share my experience. About 2-3 weeks ago, I sent a picture. I was just going through my gallery, and there was a picture I took a colleague. There was a graduation. So the graduation, one staff member took a picture with a student and a friend. And I took them the picture. So it was in my gallery about last year, yeah. So I was just going through my gallery and I saw the picture. I said, hey, you have to send this picture to Madame Akosua. And immediately I sent the picture. Her response was, hey, do you know I thought to call this lady? And all of a sudden you have sent a picture of me and her. So as I was about to send that picture I said the picture has been in my gallery for a long time, so I forgot to send it to her. And immediately I sent, later it came with a comment that, oh, this lady I took a picture with, she's in my mind. I wanted to call her, and you have sent, immediately I thought of her, you sent a picture of me and the lady. I hope you get me. So you could see that there is what? A telepathy. A cousin of mine, she's in UK, and she was telling me that she used this telepathy a lot. At times when her daughter will go out to have fun and it's late and the daughter is not home, she will just sit like she's meditating, like meditating. Then she will call the daughter, you have to come home, it's late. Immediately she closed the eyes and concentrates that she's calling the child, not through phone. She wouldn't call her through phone because when she calls, she doesn't pick because she's enjoying herself. So she will just sit quietly and meditate, like concentrate that I want my daughter to come home. So she'll be calling her, Christine, it's late, you have to come home. And she will say this severally. And within 20 minutes, you see the girl coming home. And according to the girl, while she is enjoying, it comes into the mind that I have to go home. It seems mommy needs me. I have to go. She will also have that thought. And we are saying that it is called telepathy. In English, we say, what a coincidence when that transfer of thoughts goes into another person at the same period. Meanwhile, you are not at the same place, but that thought will come into your mind. At times you think about someone, hey, this person is a long time that I spoke with her. Let me call her. Immediately you call her, then she also say, oh, you were in mind, though. I wanted to call you, and you have called. I don't know whether you have this experience. And this is what the parapsychology calls telepathy.
Madam,
Yes.
madam, sometimes at the mention of the person name, before you see your mouth, the person will appear like they heard you when you were talking.
Yes. Yes. You think about someone, and immediately the person will come to you. And also said, oh, it's been a while, so I wanted to see you. So there is a form of communication, but it has no what? A medium of channel.
Sister. Hello, sister. Please, good
Yes.
afternoon. Please,
Good afternoon.
I'm Sarah.
Yeah.
Please, can you then explain telepathy as transfer of information between minds without any sensory input? Can you explain it?
Please come again.
I said, please, can you explain telepathy as transfer of information between minds without any sensory input? Can you describe telepathy like that?
So that's why
we are saying that it is known as thought transfer. Thought transfer from one person to another without the medium or any medium of communication, a channel of communication. There is no what mediation of any known channel of communication. The channel of communication we know is the phone. Maybe you call the person, or maybe you text the person. It's a channel of what? Communication. But this one, we are saying that it's a thought transfer from one person to another without, not with, we say without. No, there is nothing like mediation of what? Known channel of communication. Please, I hope we get it.
Yes, sister.
All right, let's move on. We want to look at clairvoyance. And we are saying that the clairvoyance is the ability to see what is happening at a particular place at a certain time without having what? Any prior knowledge of the event. The ability to see what is happening at a particular place at a certain time without what? Having any prior knowledge of the event. It involves what? Able to see or give an account of an ongoing event at another place, irrespective of the distance and physical what? Barrier. Please, I hope you understand. Like, as you are at the hospital, I don't know where you are or in your homes, but you can tell us exactly what is happening to me here. You are not here, but you can tell us the dress I'm wearing, everything. What is going on here at the moment? Meanwhile, you are somewhere. That is the clairvoyance. Ability to see. You see what is happening somewhere whilst you are not there. So, for example, while studying here in this lecture room or wherever you are, you can perceive and tell exactly what is happening in the office of what? the President of the Republic of Ghana. Like somebody will tell us where Mahama is right now, what he is doing right now. Meanwhile, he's not with him, he's somewhere else. That is clairvoyance. So this deals with what? Superstition. Okay. There is a hand up. Let me finish with precognition, then you come in with your question. You end here. Our time is almost due. So precognition, this is the ability to perceive and accurately predict or you foretell events or acquisition of what information about events which will exist or it will occur in the future without any prior knowledge. So normally we say what is prophecy, and the precognition is in the form of prophecy in religion. So a precognition, no matter how accurate it is, it's not considered as what? As precognition, if it is based on what? On the known. On the known as in, if I tell you that tomorrow, that is Monday, there will be a meeting at Garden City, meaning I have the idea, they have sent me a letter that tomorrow, this date, you have a meeting or there will be an event going on. That one you have what? Known, or you have the prior knowledge of it. But when it comes to precognition, you don't know, but you perceive and you have said it in future that it will happen. And when it happens, then it is what? Precognition. Some even give football prediction and it happens. That is precognition. Okay, so let's end here. Any question? Your hands were up. Abigail Kwaku. Abigail.
Madam, please, with the precognition and the this thing,
Please,
is it the same thing? Hello, yes.
Telepathy and precognition, they are not the same. The telepathy, we say, is transfer of thoughts, like a communication. It's a transfer of thoughts from one person to another. You are thinking about something, and that thought goes into another person. The same thought is transferred to another person. That one is telepathy. Precognition is talking about perception, what you can see, ability to perceive, or you predict what will happen in the future. Meanwhile, you don't have any knowledge about it. You didn't know that there will be an event tomorrow at Garden City, but you have predicted that tomorrow there will be an event in Garden City, and it happens. When it happens, it's precognition.
Okay, yes,
So this
madam.
one is different from, please, just relax and understand the two.
Okay.
I hope you understand
Thank
it.
you. Yes. Thank you.
All right. So please mute, Abby.
Yes, madam.
Josephine Kuma, your hand is up.
Yes, madam. Please, I wanted to give an example of the clairvoyance. So
Okay.
this one is like a real life, like what happened. A woman who had her son they had a fatal accident and was admitted at CAT. So she was lying down outside where the visitors are, and then she felt like her son has fallen down. And this is quite a distance. She's not even closer to where the room is. So when she went there, the nurses were like, no, your son is okay. She's inside rails. And the woman was insisting, no, I said my son has fallen down. The nurses didn't want her to get inside. So as they were like going back and forth, a doctor was passing it. Was like, Doctor, may banner perform. So as they were challenging her and all that, so okay, just let her in. And as they rushed in, truly, the side rail has like fallen down. The son was on the floor, the oxygen tube, and they were like, hey, how did you know this? I just thought to give this example to help
Wow.
us understand.
So that is the clairvoyance. And we feel that it's people with spirit or power. How can, as we are saying, and it happened real. It was true that the sun has fallen.
Yes, sister.
Okay.
Madam,
Sister,
Yes.
sister, please, sorry for interrupting, but someone's camera is on and her breast is showing.
Let her show the breast. Me, I don't care. Watch. That's how maybe the person wants it. Maybe I don't do anything. I can't do anything about it. And who is that person?
Sister Ruth Bukaro, who something.
Oh, maybe she doesn't know.
She
I've
doesn't know
been
it.
trying to prompt her, but still.
You people should call her on the phone. That she is showing her breast. You have to off your camera. Off your camera.
Hello?
I hope we are all women here. Only women,
Hello?
right?
Yes,
Do we have
please.
males?
No.
Yes. There is a man here. There's a man here.
So the man,
yes, one.
The man, please let me talk to you. Last week I wanted to talk to you. I don't know. You didn't join the class. What's your name? The gentleman. Okay, Abideri, please talk. Abigail. Your hand is up.
Please, now, I want to know the difference between precognition and then clairvoyance.
Oh, lady.
The clairvoyance, it is happening now. Me at my office now, you where you are, you can see what I'm doing here. Abi,
Okay, sister.
where you are not there, but if I am able to tell the dress you are wearing and what you are doing at this very moment, is clairvoyance. I'm not there, but I can see what you are doing or what is happening there, is clairvoyance. Precognition is saying something that will happen in the future whilst you have no knowledge about it. And when it happens, it's precognition.
The thing is,
Okay. Thank you.
Pronouncing what will happen in future, or you predict what will happen in future.
Madam.
That's precognition.
Hello?
Yes.
Hello, Madam. Please, I wanted to ask that if this can be said to be telepathy, like sometimes we'll be, let's say, two people, although they haven't spoken. Maybe one is at the world, one is outside, but they will come like, let's say, as the person inside comes out and they all see something, they will be like, oh, all at once. Then it will be like, can that be this thing?
Yeah, at times it's like that. Something like coincidence. Yes. Because the thought in my mind or what I want to say, the same thing is also in your mind.
In your mind.
And we say it. Yeah.
Madam, and another one too, of late, they even do it mostly on this thing. Like it's mostly shown on these socials. You see that they'll be doing friends telepathy, twins telepathy. They will be like, they will hide the two people, then they will be like, raise up your hand. So you see, coincidentally, the hand they'll raise will be the same, maybe right hand.
Okay.
Take a foot, like take a step. the step they will take will be the same, let's say the same, yes. They should say a
Meanwhile,
word or choose a
they have not agreed. I don't
yes,
know
they
whether
haven't. They haven't
exactly.
seen it. They will hide, let's say, two people in two different rooms, and they will test that telepathy on them, and coincidentally, they will all choose the same thing. Maybe choose a
Okay.
color. This one will choose pink. This one also choose pink.
Okay. Okay. All right.
Yes, please.
So that's it. Can we draw the curtains?
Sister.
Yes.
Sister, please, you can draw the.
Please, sister, please, can you say, feeling pain with the loved one is when the person is injured somewhere? It's an example of clairvoyance, please.
Please, your line is not clear. I didn't hear you.
Sister, please, I said, when when you feel pain when a loved one is injured elsewhere, can it be an example of clairvoyance?
Clairvoyance. The clairvoyance we are talking about seeing what is happening at a place you are not there. But if you are feeling pain, then that one will be maybe telepathy.
Feeling pain when a loved one is injured elsewhere, like somewhere, you feel pain for the person. Meanwhile, you don't know whether the person is there, but originally it's happening there. Like when you feel pain.
Yes.
Please, in simple terms, let's just say like a soothsayer. Someone who sees something that's like a soothsayer.
They are saying that yes, something like those who they are seers, they can see what is happening.
Elsewhere.
Elsewhere, but they are not there, and they can say it.
Like soothsayers.
Something like that. Something like that. Something like this, you say yes. They are not there, but they can predict or they can say what is happening there. They are saying what is happening there. And I've made an example that as I am here in my office, as where you are not here. But if you are able to tell me or you are able to see what is happening here, and when you say it and it is accurate, that is clairvoyance. But somebody was saying that when you have pain for an injured a loved one who is injured.
Elsewhere, like the person is injured elsewhere. Yes, please.
And you saw that that person had injury. That is why you are feeling pain.
Yes, please.
I don't get it. But you know, it could also be that one will be a telepathy. Why am I saying that? The telepathy, because of what you are experiencing, you have a thought of that person and you have pain in your heart or your leg or any part of your body. It could be that person is in danger. So there was a transfer of thoughts of the person. But if you can declare that I can see that my loved one is what? Is in danger. That one is clairvoyance. So please, let's get the understanding. If you can declare that I can see that my love is in what? Is in danger. Is clairvoyance. But if it is about her thought in your mind, you have a thought in your mind and that same thought is in his mind. That one is telepathy.
And telepathy, sometimes to an extent that somebody can get hurt here, and the person will be like, call my sister, she's also hurt. And truly, when you call the sister, ask how the person is hurt, the same thing has also happened to the sister.
So that one is, yes, it's a telepathy. If it is a transfer of thought, we are talking about thought too. Let's not change, like all of us thinking the same thing at the same time. Okay.
Sister, hello. Hello,
Time
sister.
is up. Yes.
Please, I want to ask a question. Please,
Ask.
concerning the
Please, who
clairvoyance.
is talking? Please, who is
This is
talking?
Elizabeth. This is Elizabeth Adonu.
Okay.
Please, concerning the clairvoyance, must I know him or her in person to be able to tell exactly what happened at the end?
You must not know the person. It wasn't, I didn't say that. I didn't say you must know the person. Something like clairvoyance. You are telling what is happening at a place you are not there. Must you know the person? Something like a soothsayer. Okay. Somebody has come to you. Maybe somebody is missing. And somebody has come to you that my daughter is missing, I'm looking for. If the soothsayer is able to tell you exactly where your daughter or your child is clairvoyance. So it is not necessarily that you should know the person. People talk about events. They don't know them, but they talk about events. It might also be that you know the person and there is a vision about him or her. And that is clairvoyance. If you have the ability to say or to see what is happening somewhere where you are not there, you are not witnessing, but you can say what is happening there, it's clairvoyance.
Okay, sister, thank you.
You're welcome. Samsung SM dash A17 is it 175F? Who is that?
Yes, sister.
Yes, sister. Is that your name? Are you Samsung?
No, sister. No,
make sure
please,
that
no.
you write you put in your name and your index number. Teresa, someone, your hand is up. Teresa, someone. Samsung, talk. Samsung. I'm going on. I'm leaving on. Sarah.
Hello, sister,
Sarah.
please. I'm sorry. Yes, sister. Hello, sister.
I'm here.
Yes, yeah.
Sister, please. I wanted to also ask if maybe I'm a twin. My twin is somewhere, and I think the same way my twin thinks. Please, is it an example of telepathy?
Just understand the meaning. We are saying that a thought of transfer. If the two of you have the same thoughts at the same time, without talking on phone, you have not sent him or her information or a text message, but you have the same thoughts. And that same thought is being transferred to that other person without any medium of words communication. It's telepathy. Please, let's understand that.
Okay, I understand. Please, that was why I was saying if I'm a twin and my twin is somewhere.
Your twin is there, your twin is somewhere, or even you are in the same place, and you felt that there is a thought in your mind, and the same thing to your twin also have the same thoughts. It's telepathy.
Yes, please. Okay. Thank you, sister.
You're welcome. Okay, there are 3 hands. Those who are not talking, please lower your hand. Teresa, someone, I've called you severally. Lower your hand. Olivia, Edu.
Sister, concerning the precognition, we can liken it to preconception. We do preconception before pregnancy occurs. So precognition, the person talks about it or sees it before it happens. So I think when we liken these two together, we can see the difference between the clairvoyance and the precognition.
Let's link, you said something, you said preconception.
Yes, preconception is something we do before pregnancy. So precognition, the person sees it before it happens. So it can give difference between clairvoyance and then the precognition before preconception, precognition. I think that will help.
Good. So the clairvoyance is when the event is ongoing. You are not there. I'll even give example. I don't know where you are. I am here. But if I'm able to say exactly what you are doing at where you are, it's ongoing now. Now, if I'm able to see what is happening at a place I'm not there, it's what? Clairvoyance. Precognition. Pre means before. So we are talking about future. When you hear the pre, it's future. If somebody is able to say something, perceive something, or predict future events, this thing will happen. I remember when this helicopter crash, I learned somebody gave a prophecy on it and it happened. So that one, it was what? A precognition. The person saw it before it happened. So the precognition is related to what will happen in the future. Comprehend?
Oui, madam. Oui, madam.
Oui, madam.
Mademoiselle.
Who said no? I heard no.
Madam.
Yes.
Madam. Please, another example is like me, like this. Our tradition, we believe that if you break a mirror, some few days time you get a funeral. So that one, it will pre-inform you that something will happen. That's a precognition.
You should do what? Break a mirror.
Like when you are holding a mirror and it breaks in your hands. Or maybe you accidentally sit on it and it got broken. We believe that few days time you have a funeral in your family, in your family.
Please, that one is not precognition. We are talking about somebody.
It's not pre-informing you.
No, this one
Like
you have
something
a knowledge about it, so it's not precognition. You have a knowledge about it, so it's not precognition.
Yes, you said that you believe. It is your belief that when you break a mirror, it means somebody will die. So you know it. So it's not precognition. And I explained further that in religion,
before they
some call it prophecy. Haven't you heard of prophecy? Precognition is like prophecy.
Ebonowa prophecy, you've not heard of it.
Good. Ebonowa said rain will fall, and that God have told him to do what? To prepare an ark. So Ebonowa thing can be related to precognition. He has seen in the future that it will rain, and he's what? Preparing. I don't know whether did it rain, because the days that he said has passed and it didn't happen.
It didn't rain. It didn't happen.
It was brilliant.
We are still waiting for the rain.
All right, so please let's end it. I'm hungry. I'm going to chop.
Okay, sister.
So if there are no questions,
madam.
you continue
Thank you,
next.
sis. Thank you.
And I'm sending the slides to you now.
We love
you.
Thank you, sister. Goodbye.
Have a nice Sunday.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Bye.
We enjoyed
Bye.
the
God bless
class
you. Bye.
Pardon me?
We enjoyed your class today.
Thank you so much.
I also like your contribution.
We saw breast.
Bye-bye.
Bye.
Give me 5. Give me 5.
Hello, sisters. Good afternoon.
Good afternoon.
Oh, on a more serious note, the way we behave on the platform is really, really weird, and it's becoming like unbecoming. Like the way people will unintentionally mute themselves and the background noise coming into the conversation and when a lecturer is talking, like it's really, really bad. Very, very bad habits. I don't know whether they like it's intentional or they just decide to mute themselves to make noise